Hello and welcome back. Thank you for joining me again. It is my 10th episode today. And if you haven't watched the previous nine, trust my word, you're missing out. So try and catch up on those ones because it's information packed. There's a lot you can get from it, and I am sharing lots of my experience with you. And you would do well to go and see those ones. So, 3 more days to go. Very soon, it will be 15th of February, and we will be expecting the health and care worker visa to kick off on that day. So, are you ready? Try and get everything ready. You have time. And if you want to chat some more about things, just reach out to me. I'm on the social media handles, find them in the description. I'll do some investigative work and find me, and let's see how you're doing. All right, share your story. Let's know what's going on. Let's go straight to today's episode. I want to share some few but key mistakes I wouldn't want you to make as a care worker in the United Kingdom. So coming into work here as a healthcare assistant, nursing assistants, care workers, whatever it might be, domiciliary carers, home carers, matter the variations in title, chances are you're going to be doing pretty much the same thing, which is assisting and supporting others to live their daily lives. So there's some key things I want you to look out for. We're learning from other people's mistakes. Quite a few people over the years have done certain things that did not end well for them. Some have lost their jobs. Some have gone on to be, they had to leave. So I just want to make sure that you don't make these mistakes, okay? Let's learn from other people's mistakes and not make our own if possible. So first on my list would be keeping the boundaries. So professional boundaries, you don't want anything inappropriate. So inappropriate behavior, actions, language, name it. You have to be aware of that. And what am I referring to in particular? For a lot of you would have noticed there's a lot of vacancies to work in the community, especially in people's homes. And that one is somewhere where you could get into a bit of a sticky situation if you don't maintain boundaries. So in the health and social care sector, there's a lot of attention given to training, and training in particular to safeguard vulnerable adults. Of course, we're talking about this visa type, so I'm not talking about children now. I'm talking about the adults and social care sector, which is the visa type we are discussing. So there's a lot of that, lots of training, and they guide you and remind you to safeguard adults. So if you know of abuse, you suspect abuse, and you yourself, please do not carry out the abuse. There's a lot of that. So when it comes to the working in people's homes, you need to be very careful that you don't necessarily fall foul of the guidelines and the law. Keep it professional, in particular when it comes to things like having relationships with your clients, service users. Try not to do that. Yeah. Try to keep it as professional as possible. Quite a few people have gone on to have issues, or family members of the same service user. So as much as possible, remember you're there to do a job. Remember that you're working usually with people who are vulnerable. There's a reason why you're in their homes. You're in their homes because they need your help. So remember that relationship. There's an imbalance in the relationship, and that is one of the constituting factors when it comes to establishing if there's been some inappropriate behavior, but also if someone has taken advantage of the other. All right. So remember, you're coming there to assist and support them. You're in their home. They're the vulnerable clients and the service user. So please make sure that you're not falling foul of that one. So my next point carries on from the first, actually, and when it comes to things to do with financial. So especially when we're talking about financial abuse. By the way, remember, this is not a training video. I'm explaining things to you from people's experiences, people who have gone on to have issues in the country as regards things that they did or did not do, for that matter. So I just want you to know, beware, think about these things and look out for them when you come and you start your journey in this, laudable job. Think very carefully, especially again, if you're in people's homes. They might need you to help them carry out their financial transactions, taking them to the bank, helping them fill out, things to do with their bank records, even write out checks for them, help them go give your ATM card to go withdraw money on their behalf. Be very careful. Keep records. Keep it tidy. I mean, if you're working with somebody, for example, who's got dementia, or someone who's ill, or somebody who's prone to forget things, whatever it might be, just keep your own records, but also be very, very careful about making sure that what you're doing is clear. You check and check again. Be sure that that's what they want you to do. So they want you to go and get some money for them and then put it here or put it there or spend this amount and then bring back this change. Keep it tidy, keep it clear. As much as possible, try and make sure that whoever your supervisor is, because you're not working on your own, are you? You're employed by someone, supervised by someone as well. And you might even have an entire team working with you. You might have co-workers. So the buddy system, where your shift is actually shared with somebody else, so that you do the days, they do the nights, that sort of thing. As much as possible, tap into the support that you have. Let someone know, let the right hand know what the left hand is doing. Do you see what I mean? So let somebody know that this is what you've been asked to do. You've been given this money. If you're given gifts, so I'm coming down to financial abuse as well. Gifts, you see, that's one that's cut quite a few people out. You know, some of the elderly individuals giving scenarios. So I'm trying to explain to you, but I'm remembering scenarios from colleagues. So elderly patients giving you gifts, especially when it comes to money. You see, money in particular, when it comes to money, think about it. When it comes to money, very sticky. Giving you money and say, oh, no, this one's for you. Thank you, thank you, thank you. Because it is, once again, that relationship, a bit of an imbalance. They're in need, they're vulnerable, okay, and they're thankful, they're grateful to you for what you do. But remember, it's not just you doing it, it's an entire team behind you. All right, that hospital doesn't belong to you. Wherever you're working doesn't belong to you. You haven't come into the employment by yourself, and so you are not just an individual worker. You are a member of a team. So as much as possible, anything happens, let the rest of the team know. So find out what the policy is for where you work. In some places, I'll give you an example, they will say anything that's offered, as much as possible, you say no thank you. But if they insist, do not offend your patient, and you accept it and let them know straight away that it will be for the whole of the team, because that's how we work here. We're a family. And I don't know, I dare say there won't be anybody who say absolutely not the family, just you. I don't know of that. So as much as possible, let them know, and then you hand it over to whoever, whatever your policy is. Follow that guideline, follow that policy, make sure that people know. And if it's a box of chocolates, like they do all the time, especially during holiday periods and, you know, celebration, Christmas, whatever it might be. Valentine is coming. You get a Valentine. I digress. Anyway, so when it comes to things like that, box of chocolates, etc., let the team know, oh, thank you for this. It's going to go to the team. We're so thankful. That's really helpful. That's really welcome. And then you share. Okay? So that as soon as that happens, it's open, candid. You know, you put it out there. Everyone knows. When it comes to money, as much as possible, it's a no, thank you. Yes, no, thank you. But if they do insist, you have to let them know that this is what's going to be happening. It's going straight to your supervisor, because you have to disclose it. Always disclose it. If the manager then decides, oh no, I too think you're absolutely fantastic, and on this occasion, this one belongs to you, then that's fine. That's between you and your manager, your ward manager, whoever. But make sure you disclose it. Next will be something that we see quite a lot. Resist the temptation to work during your sick leave. And this will come with people. So I will explain. I know with this visa type, there's a financial requirement, so you have to stay the £20,480 annual salary and all that. You are allowed to work extra hours on the visa. So it's not just what your one employer has fixed for you. You have the temporary, the bank staffing, office, the temporary in your hospital, your care home, wherever you work. They will give you extra hours. Oh, please, can you do more than your 37.5 hours for us? Do you mind working on this Sunday, that Saturday? We'll pay you extra, blah, blah, blah. That is allowed. So you can do your shifts according to the policy of where you work. There might be a limit, a benchmark where you can go beyond 42 hours, beyond whatever it might be. So you stick to that. Don't fall foul of the employment law as well. However, do not think that because you're under pressure, resist. Under pressure to keep a certain amount, to be able to live off this, maybe send some back, take care of people, etc. We're humans, we understand these things happen. Resist that temptation to go ahead and pick up shifts when you've already been paid for an absence. Okay? If an absence is already paid for, training days, sick leave, they are paid for. Training days, sick leave, they are paid for. Do not pick up a shift elsewhere, or even there in the trust, because maybe somebody's made a mistake and they forgot to check that you're not supposed to do that, because that might be an error on their part, but you're liable for your actions as well, because you should know that you don't do that. That is actually financial fraud. So please, I know most of you might not even know that it is, and you do not intend to defraud. But please, that is one that's been it's just something of a honey trap for quite a few care workers. And they think, oh yeah, I'm allowed to do more hours. I want to be industrious. I'm hardworking. I'm going to do quite a few hours. I'm going to make my targets weekly to make this amount of income. But just remember, when it comes to things like your training your financed or your paid for absences, don't do it. Please don't do it. Next one would be working within the boundaries of your role. So you've been employed to carry out a particular role, and that role has its guidelines, the things you should do and things you should not do. You've got responsibilities. As much as possible, and I say this because of the pressure of the job, sometimes there'll be a lot of pressure, you will see, and there'll be days like this. There'll be days where the pressure is so much, and people are asking you to do things that are outside of your boundaries, things that you're not allowed to do legally. The guidelines, the law, things that protect you, the ambit of your role. Please try as much as possible to tell them no. You can do it very politely. You can do it quite, however you would do it, just do it. The answer is no, can't do. And give reason. Yes, you're not trained to do that. And even if they feel that, oh, but you see me do it 100 times, I'm referring to your nurses now, people like us who will be working with you, that will say, oh, please, just, just, don't do it. You two go, oh, please, me too, I can't. Yeah. Just be careful, because at the end of the day, you stand for yourself. You are responsible for your own actions, and you're accountable. You're accountable to all sorts of bodies, from the CQC to the government, obviously. There's a lot. So just be careful that you do what you're trained for and what you're allowed by the guidelines to do. You understand, some of you are even more trained than we are. In your home countries, you do a lot more than what you'll probably be doing here. But wait for your time. There's a process to everything. There's a process, and there's a time for everything. So wait till you are accredited. Wait till you're certified. Wait till you're certified. Sorry, not accredited. Wait till you're certified to do a particular task before you would do it. So if you're signed off to do that, then you can do it. If you've got your training, you go up to do your nursing degree here, or you do the conversion courses or whatever it might be, then you know what you can do. But if you're coming in as a care worker, healthcare assistant, nursing assistant, whatever it is you're coming in as, you have to stick to that. So please, do not pick up any injection and try out your skill, because in your home country, that's what you do. You're a nurse actually in your home country. You're a doctor in your home country. We do understand. And with time, hopefully, we do wish you well. You will climb into your usual role and you will carry on and grow. But for now, please, so that you don't end up in front of anybody with their glasses done. So, yes. And what was that you did? Please resist the temptation. So the nurse is asking you, oh, give so-and-so patient this medication for me. It's the nurse's role to do that. If they want you to write down anything, that's different. Take records, go check and say, I gave it to her. I just want to make sure she hasn't kept it anywhere on the table. Can you just have a look when you're around there? Because yesterday she did the same, things like that. Yes, you can have a look and say, oh, I found it. She didn't take it again. Let the nurse know. So the last point for today is to bring up one that you may not be used to, but I'm sure you've heard about it. We do pay tax here, fantastic tax. It does a lot of things for us in the society. The light does not go off. There's water. I'm just jesting. Don't mind me. My point is, please, as much as possible, there is a personal tax allowance for everybody, which means that a certain amount each year is for everyone. It's set. Okay, I think this year might be up to 12,000 already. I can't remember what it is. So the first 12,000 you pay, or the 11,900, or the whatever the figure might be. If I find it, I'll put it up somewhere here. It will not be taxed. Okay, it's a personal allowance, and everyone gets it. It's free. So there's that. And then after that, then you start to pay tax based on whatever your rate you're learning. So it's a PAYE, pay as you earn system here. As much as possible, do not begrudge our dear queen and country. That's tax. All of us, the society, do pay it. Trust me, it's not what you think it is. You don't. I know if you start to calculate your tax and you convert it to your currency back home, you're probably just going to have a, So just let it be, because you're earning in that amount here, you'll be paying in that amount here. So nil, it balances out. Try not to, I'm going somewhere with this, try not to register your third party companies and employ yourself from there so that you can have reduced tax. There's some people who are going to tell you very, very clever things. Some people are so good at things like this, they will advise you when you're coming, oh, by the way, do you know how you should do if you want to save here, you want to make extra there? As much as possible, especially on this visa type, I would say try and avoid things like that. Okay, I would rather you were picking up extra shifts within your setting where you work and making extra money and working, smart to say, oh, okay, if I have some extra days, I need some to rest. But I find out that if I do a night shift, I get paid more. If I do it, so I prefer that you were doing that sort of mathematics than for you to say, oh, actually, I'm paying a bit too much tax. I don't want to do that. So I'm just going to register this company and I'm going to employ myself there and I'm going to pay. I don't even think you can do that on this particular visa type. But even if you do think you can get away with it, at some point it's going to come back and bite you. Because to start with, you'll be falling foul of your visa when they do find out. You can't be employed via a third party. Remember this? Yeah? So look at the visa type and understand. I'm not an immigration officer, but there's certain people who have used that and they've used it so aggressively and things went wrong and they were called up and they had to answer for it. So please try to avoid things like that as much as possible. Just let it be taxed at the source. What comes to you, belongs to you. You use it. You want some more, you work for more. Don't start trying to do clever things and trying to reduce your tax or not even pay it at all. Please try not to do these things. All right, just a few things. As time goes on and as we get closer to this date and beyond this date, we will use other people's mistakes, errors, to learn. Okay, yeah, that's how we do it. Yes, that's how we do it. So we don't necessarily have to wait till we make the mistake. Let's learn from others. Because they did things that we want to make sure we never do. But I do wish you the best. And it's countdown. Yeah, we're almost there now. So please, as much as possible, get prepared. And talk to me. Let's chat. Did you want to say something? Say hi. Okay? Yeah? I'll see you on the next one. Don't forget to subscribe this. Yeah? Subscribe to the channel. Share. Like. Talk. Next one.